USA and New Zealand, London, UK, all different countries from 20 years. And last 5 years it is coming in India. What's the main difference between sports therapy and physiotherapy in busy life? Actually, sports therapy are done to bring back the athlete immediately to on field. We have a specialty department called sports medicine department. Sports medicine is not just giving a medicine internally, orally. It is like an umbrella where sports nutrition, athletic coach, everybody comes under the sports medicine. So, if we talk about sports medicine or sports therapy, it's a very big chapter. Things in a very nutshell what we are doing, and then how it will be beneficial for injury. So, I am practicing doctor in Chennai. I just treat so many sports people, also high performance like in dance and all. This is like a description what we have given. I can share this with you. Already I have shared this with you, sir. This is like, if I say these things, it will be always, it's already in the internet about the description and all. So sports therapy is something to prevent the injury, treat the injury, put back the athlete back fast on track. Next. So what you do first, person get injury, what is the first aid is to prevent them or to stop them to the play, to give them a rest so that the further damage to the athlete will be monitored and then stop immediately. That's the first step, prevention. Next. Next. So what kind of injuries all happen? Concussion injury, head collision, head-on collision. Concussion is something like the person and the sports people will be like spaced out, and then they cannot able to talk, or sometimes they stop breathing also. So immediately you need to open the jaw and then rush them to the hospital as early as possible. This is concussion injuries. Rhabdomyolysis. So rhabdomyolysis, we need to know about this because when a person, everybody has a limit for their performance. So when the person wants to do the superhuman performance without doing a proper training, scientific training and approach, what will happen? The muscle fibers get destroyed, myoglobulins will form, and then that will further damage the kidney. So the high performance, when a person goes to a national level to international level, it has to be done proper scientific method of approach so that such kind of injuries will be stopped. Rhabdomyolysis, you can search in YouTube. Suddenly a player runs fast in a football track, he collapses and dies immediately. It's all like a due to rhabdomyolysis. So, don't force the children until unless they are capable and with the proper training. Okay, that's the take-home point. Spinal injuries. Regularly, spinal injuries will happen. So when I come for the manipulation, I will just talk about all spine injury, how the spine works, what's the spine biomechanics, how to sit, stand, walk, all. So dislocation. Dislocation, before that subluxation is. Subluxation is like when our body is completely made up of joints. When the joints are present in the articular cartilage, the articular region, it has its own movement. Every joint has its own movement when it is in its own. When there is a small disruption or it is like moved little bit from its position, the function of the joint goes to the dysfunction, and then the performance will be less. So first thing we need to check if a person is coming for a pain, we need to check whether the person is having a subluxation or anything like dislocation. Muscle tear, very common injury. Everybody will come across that. Even early morning will get a beyond will get a catch. It is a tear of the muscle fibers. Okay. Ligament tear, high performance sport or like torque force. Mostly the ACL ligament in the knee will tear when a person goes to the agility or endurance, when they just give the torque force, rotation force, when they give this dominant leg stand and without giving any relaxed movement, when they do a sudden jerk twist movement, torque force will happen and the ACL ligament will tear in the knee for all the activities. Cartilage tear. Cartilage is something like in the knee, if you see like before the knee, the cartilage tear. When this cartilage degeneration happens, we call this arthritis. So cartilage tear will happen in any kind of sports injury, mostly in knee joint. Asthma. What's the relation between asthma and when a person is playing around, regular inhalation of dust and with small particles, this irritate the upper respiratory tract and then it creates the wheeze and asthma. So proper cardiovascular aerobic and aerobic exercise needs to be given in training. So diabetes. So many people are turning out diabetic, even the players, high performance players, so many players just take insulin and then they just wait for a World Cup and then not a World Cup. So many players, so it depends upon whether the blood sugar level is high or not. Shock, any injury, pollution and wound, bleeding. These are the very common injuries. Fractures and organ damage. When a person hit it may cause any kind of injury to the organs. So these are the common injuries happen for the athletes, and then these some conditions like almost 70 to 80 condition can be treated without medicine in this. Next. You know, we have the first aid kit. So first aid kit is electrol bandaging, and nowadays we have this specialized sports bandage. How many of them came across this one? Can you say? Kinesiology tape.
Just to show you that.
Kinesiology tape. How many of them came across? So it is the general tape and this tape difference is when we do the club bandage, it will affect the performance. So during the play, club bandage is not used. But advanced sports therapy method, we use this kinesiology tape. It do not interfere the joint movements, and then it do not interfere the performance also. So this is the advanced tape. I am just going to do some demonstration with this also. So it will be so much interesting. Kinesiology tape. It will come. Kinesiology means muscle movement science. Next.
He is there, sir.
Sir? Next.
Change.
Kinesiology tape. Muscle movement. So mostly any kind of injury and inflammations, without medicine, this tape, if you put this tape, the inflammation will go until unless there is no fracture. airline crack. Airline crack also sometimes it will work nicely, but without any crack, any kind of injuries, the inflammation will be taken within 3 to 4 hours without any medicines.
It will be available now.
Yeah, but application you need to know the procedure. You need to know about the muscle, how the muscle origin and insert, so that it will be like a 3 month course. Next, cupping therapy. It's like we used to do this cupping therapy. Our grandma used to do this cupping therapy. But when Michael Phelps is done this, world-class treatment, like in Rio Olympics. After that, it became a world-class treatment. Cupping therapy, all the therapy just we just put the pressure from outside to inside. This therapy, we just pull the body structures out. What actually happens is our body tend to form muscle knots and all. So it will break the knots and stiffness, and then bring back the regular position and the structural normalcy of that area. Next, ice therapy. Traditionally old and see, if at all you don't get the ice, you can use the ice bags, gel. But when it is possible, use ice, because ice therapy give a high beneficial thing when any kind of ligament injuries happen. Any injury near the joints, ligament will be affected. So ice plays a vital role. Simple way to apply ice is just if the injury is in the knee, just apply some basic coconut oil. Take that ice cubes in silver tiffin box, and then you can roll over for 15 minutes. This will give very great relief in pain and inflammation, and reduces the blood clots. Immediately when the injury happens, the hemostatic phase is the first phase of thing. It creates the blood clots there. So the prevention of the blood clots, and then it helps a lot to reduce and increase the circulation of the area, and also gives a wonderful pain management. Dry needling is one of the advanced techniques. This is not acupuncture or anything like Sujetshu or not. This is 100% evidence-based therapy, which is for all over the world. All the sports injury are handled with this techniques, and dance injuries are all like that. It gives instant relief. It works through neurophysiology. Next. Can you just pass on the needle to the thing? This is the small needle. The small needle. This one is the needle, and then this is the follow-through pipe, and then handle. You can see the needle inside. So this is the needle. This diameter is 0.25 mm. When it goes through this, there are different methods: 90 degree, 45 degree, and 15 degree, according to the structures we need to. And then needle size will be, this is 40 mm needle, then, and then 25 mm, 40, 60, 75, 100 mm needles we have. So what actually happened when we put the needle inside the dermis and then create the targeted injury? Our brain heals and treat all the injury happens. Our brain sends medicines to heal that particular area. When we do that of your own hand, see the nodules. You can see the nodules. Hard nodules. So when injury happened, the hard nodules happened, resulting in reducing the body function. When a protective spasm happened, the body function gets reduced. When a needle is inserted in this region, what actually happened? Next. See, single sarcomere is the functional unit muscle. What happened? Actin and myosin will get overlapping. Actin and myosin get overlap, and this is called neuromuscular junction. In neuromuscular junction is the junction between the muscles and the nerve traction region. When we put the needle disrupts the integral structures of the muscle fibers and ending, neuromuscular end. Immediately when there is an injury happened, local twitch response through neurophysiology. Local twitch response, LTR. LTR will just release like a shock. The protective spasm in the muscle will release like a jerk. It is called as LTR. Immediately, in any kind of chronic pain to acute pain, stiffness, muscle stiffness, immediately a single needle, if we put that in a proper area, immediately the pain start decreasing. And in conditions like ligament tear, mostly we will get grade 1 ligament tear, grade 2 ligament tear in the injuries. More than that, we cannot able to stand or anything. So in a grade 2, grade 1 ligament tear, immediately we put that on the ligament, the needle on the ligament, the pain disappears immediately. So this is a very powerful. People, to my clinic, people will come with limping. We just target the hamstring muscle pull. They just suffer for also sciatic pain. They just suffer for like 15-20 days. On the proper triggers, if we hit after the examination and a physical test with some like a straight leg raising test, SLR we say, whether it is like sciatic nerve is involved or not, we put the needle directly. It will just release the pain immediately, and the patient can able to feel that the instant relief. So that's what grade 1, grade 2 will get relief in this primarily. Grade 3, more than grade 3, it's all the person want to continue the sports, surgery is the best option. No. Pardon? No, that's what I have shown is that single treatment. They're all like sterile single-use needles. So we use also we need to open the needle only when we want to. Yeah. Fresh injury we can do.
It's our 10 years before the ligament.
Well, 10 years before ligament, body will heal itself. See, ligament tear is of like grade 1, grade 2, grade 3. Grade 3 is more than 75. So, till 50% no, we can treat with rehabilitation. So, if it is complete tear, if the person want to go for a high performance sports, surgery will be the option. If at all, pardon? Yes, very nice question. For that only many people will come to our clinic. Because actually, I have a PCL tear patient. 4 years before I treated him, now he sits, stand, walk, run and all. We just made him to understand how he needs to sit, stand, walk, and how he has to keep the bike and then we have strengthened all the limbs from the hip to toe, and then the way of approach of the treatment will be like first balance we need to reach the proprioception. Balance and then proper movement like flexibility. Yeah. In exercise we will fix like this: balance, mobility, flexibility, performance, high performance. So mostly when a person is carrying a deadlift, he will be carrying without a balance. He will take the deadlift like this. Teach the balance. How long they can stand. For every joint, we have a balancing exercise. First protocol, American School of Exercise, and then NASM, like School of Sports Medicine. Everybody say like, first we need to create a proper balance. Then mobility. Mobility is the movement of the joint. Flexibility is like movement of the muscular structure. And then performance, then high performance. So, next. So these are the trigger points. These are the trigger points. So everywhere we have these triggers all over. If anyone has any chronic pain or muscle pain, you can come, I can give you, and then I can relieve the pain. Anybody want to try?
This is only for back, right?
Back.
Yes.
Come, sir.
Always I am ready for what we can run You want to learn, that's only. That's why I am a guinea pig now. എല്ലാരും വീഡിയോ എടുത്ത് വൈറലാക്കി കാൽ കീഴ വെച്ചു இங்கே ரெஸ்ட்ரிக்ஷன்ஸ் இருக்கு Little spondylitis I am having. 24 hours computer. கொஞ்சம் ரிலாக்ஸ் ஆகும். Needle will be like a small prick only.
Sir, will you shout?
What the fuck?
Needle பண்ணோனே ஒரு சிலர் கத்துவாங்க. நான் கத்துவேன்.
கத்தி ஏரியால ஷவுட் ஆகாது.
Relax.
Sir, relax.
Just
Relaxed.
Wait. Don't disturb. Relax. For your information, my wife underwent the same treatment with the doctor for a back pain and a knee pain. And she recovered totally with the same therapy. This needling, after needling, you'll have to relax for a few minutes, and then doctor will take out the needles and he will do a small massage. And there was an instant relief, and after the due course, it got totally clear.
Any chances for people who are paralyzed, sir?
Paralyzed. I don't know about that, but for the back pain and for the pains,
See, psychological treatment is another one.
Any chance for that, sir?
No, actually, if you do like 3.5 mm needles on the nerves only, it create.
Not completely paralyzed, sir.
100% the region what we target is not those areas.
and then I took my relations, everybody there, and everybody got.
அவங்க எந்த போன்ல கை வைக்கிறேன்னு தெரியாம பண்ணுவாங்க.
And in the dispensary, we have n number of patients with this sort of problems only. It's filled with the patients of this pain and muscle problems and stiffness.
காலையை ஃப்ளாட்டாக வச்சுருக்கேன். நான் வந்து இந்த நெக் வந்து சரிங்களா ஃப்ரீயாக ரிலாக்ஸ் ஃப்ரீயாக ரிலாக்ஸ் ஆகும் சார் ஃப்ரீயாக ஓகே சார்
You relax.
I will tell you one thing. This pain I was yesterday only it happened. There is a very small tree there. I tried to climb on that tree, but I didn't say what happened to me at that time. Here I was present there. I used to climb trees. Just to jump and just try to catch something there. Then only it happened. God party is little then started what a shooting pain. I didn't tell me that. How I
actually what I found with sir was when I just palpated this C7 bone, it was rotated. So it is rotated on one side. So what we have done is we have needed this region, all these paraspinal muscles, all this muscle will be up and then it is rotated like this. So we have needed this region to release the muscles and then just manipulate it. This is like a cradle movement we see in the manipulation. You just hold them in the forearm and then open in the 34 degrees. When you just open this, what happens? This bone, when it is rotated on the opposite side, it comes to this normal position. So, like after I just manipulated all, I can see only the C is rotating. These conditions, mostly in, when we see in these spinal injuries, mostly what happened if you see, this is the facet joints. This is the facet joints. This one is the facet joint. Mostly, what the person will do is, in this thoracic spine, easily it will be get twisted. Due to we are sitting like this, hunching, and then we are sitting like this, rotated and all, it gets rotated easily. But in condition of lumbar spine, see this lumbar spine, this is T12, thoracic 12, and L1. See, it is locked. And then here this bone has a easy movements. This is T11, T12 and L1 is a first junction that it gets locked. It gets locked. Mostly what all of us will do with the crisscross leg or jumping and all, we will put this facet outside. We put this facet outside and our trained doctors will ignore this because they are not trained in this. Our tradition, Varma therapy, Varma Kalai, or we do like this, but the one problem with them is there is no scientific correlation. And when this facet lock happens, the restriction in movement and there won't be any neurological deficit. All neurological things will happen normally. There will not be any problem in the neurological way, like a numbness or any kind of weakness or swelling like that. Chronic pain will be there and dysfunction. They cannot bend up and down and pain will be more. They cannot do any kind of work. So what we will do, we will have a rotation, opposition, stabilization technique. We just make them to lie down and then we just put this back with the proper torque force. Rotation and opposition force will make the person to lie down on the bed. Angle of the, according to the L1 to L5, we can change the leverage with the legs. 30 degree to 60 to 90 degree and then we rotate accordingly. So we have done almost 4,000 to 5,000 cases. Every day we see minimum 4 to 5 patients of this case. And another main dislocation I have told dysfunction, mostly it happens here, SI joint. The patient will sit, stand in a very discomfort, not in a balanced way. This is sacral joint. This is ilium bone, this is sacral bone, and then sacroiliac junction. So what happens when a person is not standing properly? When he stands like this, when he stands like this. Stand like this. So what happens? This SI joint will get injured. And if you are not standing properly, immediately your 3 joints will get injury. That is knee, and SI joint and acromial clavicular joint. This one. Yeah. AC joint you see. This is like when we are not standing properly, knee will be injured, SI joint will be injured. See this SI joint in the anterior aspect. SI joint will be injured and shoulder joint will be injured. So standing properly is the most important thing. Disease will come in different way. One is traumatic, any kind of injury, sports injury, washroom during bath will just fall, footsteps will fall, in the ground also will fall without base. Those things will come under traumatic injuries. And another main thing is metabolic issues. Metabolic issues from inside, like uric acid elevation, diabetes, cholesterol, any kind of cellular degeneration. So metabolic injury will be there. When you have a pain, we say like a mechanical injury. That is not standing properly, not sitting properly. People will sit directly on the tailbone. When we sit on the table, we need to lean little bit front. Don't sit straight on the spine. you want to sit straight, just have some pillow or any base and sit. Or just lean little front so that the coccyx tailbone will not get injury on the below region. So that's the most important thing. So standing, I'll just show you little demonstration about how you need to stand. Then what are the injury caused by when you stand in a irregular way? Anyone want to volunteer? Please come. Sir, looking like my biology master. So see, when he is standing, shoulder, see this is the shoulder socket and then the hand, upper limb coming out from the shoulders. Okay, this is the hip socket. The lower limb comes from the hip socket. Okay, this is called as pelvic girdle. This is called as shoulder girdle. Okay, so when it is coming from here, he is hanging out in the proper way. When it is coming down, he is not keeping his foot in the proper way. Okay? Sir, stand please. With attention. Yeah, stand it. Relax. Little. So this is the way. When the upper limb is coming from the shoulder girdle, it is coming down. So when a lower limb is coming from the pelvic girdle, it is coming in the same way. Instead of that, if I stand here, imbalance. Can you feel that? Balance. Simple. Okay? And another thing is, if you see sir, he is putting all his weight on the ankle. Putting all his weight on the ankle. We need to use full foot to stand. So, because Kalpula is calling that. Before he was using only the heels. Mostly, sir, yeah, we do
Back to back.
When I stand on my heels, please ask him how much force he is having on my shoulder.
I'm taking 50-60% of the load.
Now I am changing, translating my body weight. I am just going to use my full foot. So you can put on there. You will load it. No. This is another small example how you will stand. And another thing is, when you stand on the heel, what we do without your knowledge, while the knee is getting into your knee, you are just locking your knee, hyperextension knee. So when you lock the knees, all backside you will get, all the muscle chains you will get pain. So you need to use full foot. So this is one of the way you need to stand. Sitting is another way of the proper way of sitting is
ಎಲ್ಲ రెండు ಬುಕ್ ಹೇಳಿದ್ರು ನೀಡಿ ಹೋಗೋದು ಮತ್ತೆ ಇಂಗ್ಲಿಷ್ ಯಾರು ಬೇಡ
அதான் பாடம்.
இது வரைக்கும் நான் நிறைய
That is one of the things.
அவர் ஸ்பெஷல்
எங்க போனது சேர்ல உட்கார்ந்து தான் கேட்பாங்க. முதல்ல சார் கீழே உட்கார்ந்து.
Okay. Actual, see like shoulder, இங்க பாத்தீங்கன்னா shoulder, hip 90 degree. Okay. Hip to knee 90. Knee to ankle 90.
Yeah.
So இங்க வந்து ஒரு பில்லோ கூட வச்சுக்கலாம். அதே மாதிரி டேபிள் மேல உட்கார்ந்தா டேபிள்ல உட்கார்ந்தீங்கன்னா கொஞ்சம் லீன் பண்ணி உட்கார்ந்தீங்கன்னா கொஞ்சம் கம்ஃபர்டபுளா இருக்கும். ஸோ இந்த மாதிரி தான் ஸ்ட்ரைட்டா பண்ணணும். லைக் திஸ் ஸ்ட்ரைட், யூ வில் கோ ஸ்ட்ரைட் டு தி ஸ்பைன். Some people come to my clinic, they say like sir, spine stiffness. They sit like this. And then they say 20 years I have pain. They stand like this. 20 years. And then first thing to treat a knee pain is to teach how you have to sit, stand, walk. I have seen so many athletes not having a proper balance. We go to any gym. If you go to a sports specific gym, like a sports rehabilitation gym, they start with balance only, because that's the real protocol now. Past when this all science emerged, they say like a proper balance. And then if you go to any normal gym, they just teach jumping, aerobic exercises, anaerobic exercises, and all fast. But after 3 months of training, if you ask them to ask the same person or the patient or client to show some balance, they will just shake. Simple balancing exercise is standing on the one leg. So you can able to feel like how much time you can come. All this like paralysis patient, nerve injury patient, we used to monitor the balance. Now every week we just make them sure that they increase their balance. So we have like different particle training exercises to create the balance. Without balance, there is no high performance. Without balance, if you do this exercise, you will end up with that injury. So when you want to do the balance, proper balance, in biomechanics we say when we need to generate the force. When a person is approaching, when a football person, when a ball is there, he is running to approach the ball to kick towards the ball, approach. First, before kicking, he creates the balance with the front foot, and then force production will happen only with the proper balance. Go next step. So without balance, and then without a balance, when a person, basketball person, jumps to put the ball, he gets down and then hit the heel, Achilles tendon, grade 1, grade 2, and then grade 4, grade 3, grade 4. Many end up with even coaches. First, they just get the injury in the training session also. And then Achilles tendon injury will be more like in imbalance basketball. And when a person comes with proper tennis force production, like just throwing the ball up with the balance, he goes, creates the balance, and then jump to create the force. After force production, when the ball comes in contact with the bat and recovery, he needs to come in a proper way, all because of if he has a proper balance training, he can able to come to the normal position. So we have some small exercise for balance. Can you all stand? Okay? Just take it easy. It's not like anything personal. Give yourself some space. When I say hop in a single leg, like jump in a single leg, you just do it for like 3 times and then I will ask a question. Anything, whichever comes to you. Okay, jump. Okay, overall done that with the left leg. That's your power leg. With the right leg, we all done. Who all cannot do, all can do. So, which leg comes first with the power leg? So, we need to train, when you want to do the proper training for specific sports, we use this technique accordingly to create the sports with the thing. So, just a small balancing, how much time you can stand in a single leg? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18.
Yes, sir.
Yeah. 21, 22, 23, 24, 25, 26. Okay, relax.
Like this would be asking the forward
Yes.
Sir, for balance, primary needs to connect.
On the opposite leg.
Is it not a practice? Is it not a practice? Practice
Practice பண்ணலாம். See, if you practice this balance only you will get. And then, so be very cautious. We are going to stand. After, when I say 5, after 5, just close your both eyes and stand and see how long you can stand. If you feel giddiness, immediately make sure you are not falling down. Okay? 1, 2, no sir, not yet, with the both leg only. 1, 2, 3, 4, close your eyes. 1, 2, 3, 4, 5. Just follow the command. Stand in one leg.
close guys.
Close legs. So these are the basic balancing exercises to train the brain. This is a proprioception training, and in sports performance training there are so many exercises. All the exercises are like through functional training only. It's not like isokinetic exercise machine and all. All are like
After closing your eyes.
yeah. So now one leg stand.
to dance aadnadu.
When I say close your eyes, just close. 1, 2, 3, 4, close the eyes. 6, 7, 8, 9, 10, relax. See, I went to Sri Lanka, and there are a lot of students. After lunchtime, they are all sleeping. I said, in between Muslim ladies are there. They are having burqa. When I say single leg stand, they are just standing like that. Single leg stand, I cannot able to see them. I said, why you are not doing? Why you are not doing? Sir, we are doing. So that one was a different experience.
Sorry.
That is also. So these are more how much you can able to do the balancing exercise we'll get more changes. So quickly, I'll just finish this kinesiology taping.
அந்த கான்சன்ட்ரேஷன் போயிடுது கண்ண மூடி பார்த்துட்டு நம்ம ப்ராக்டிஸ் பண்ண முடியும் ஸ்டூடெண்ட்ஸ் பண்ணிட்டு
This is the kinesiology tape. So cotton elastic band, and then this is the paper, just to facilitate this. You are able to see if I open this stretch, you can stretch this. So you can appreciate the pores and openings. Can you able to see the pores?
Yes.
So when you apply on the skin, what happens? You need to take that hair before that and clean and apply on the skin for the good benefits. To get more benefit, you need to take that hair and apply. And what happens? Why this pores are given is like just to take the expression, the secretions. Another thing is this one is waterproof. So when we apply the tape, you can have a shower regularly, just to shower and then take the dirt out. So it dry by itself easily. And then if this special tape, you can do it all the therapies which are found in the world nowadays, which you have, can be done when the athlete is out of the stage. So when an athlete is out from the field, he can able to do the treatment in the clinic or outside. When an athlete playing inside, if you put this tape to them, it helps them during the play also. So one of the specialized technique. So anyone has, I can do a demonstration with this. Anyone has some hand pain or anything?
கையில் விழுந்துடாதம்மா பார்த்து பிடிக்கிறது பார்க்கலாமா
நம்மளோட
என்ன ப்ராப்ளம்
எல்போ பெயின் ஆகுதாம்பா
இல்லை some other health issues.
See, what actually happened in this, it will lift the skin and I can show you that. What happened
No
when
chair.
the trigger is there, the negative pressure and then there is no circulation will be there. What happened? Like if we pull the skin and the underlying fascia up so that the circulation increase naturally.
பிளட் நிறைய போகும் பெயின்
சரி அதை நைட்டு போடலாமா? நைட்டு போடவா சொல்லுவாங்களா?
டவுட் கேட்டேன் நைட்டில் போடலாம்
நைட் போட மாட்டோம்ல, கிரிப் பேண்டேஜ்
அது
போடுவோம்.
கிரிப் பேண்டேஜ் போட மாட்டேன்டா
இது என்னது?
போட்டுங்க குடிக்கலான்றாரு அவர் வாட்டர் ப்ரூஃப் காஞ்சிடும் டவுட் கேளு
Inflame the muscles. Compress
எங்க ரெண்டு
lymphatic
பேரும்
drainage.
அட பாவி
ஏப்பா
Blood vessels.
ஏன்
Compress
ஏன்
the surplus. Reduce the lymphatic drainage.
கிரிமினல்
Reduce the blood flow.
கேப்ல
Pain.
கேப்ல
இப்படி
When we apply the tape on the skin and pull the fascia out,
கணேசன்
it changes to
அவன் தான் எடுப்பார் வேலை
compression to decompression.
மக்களுக்கு எவ்வளோ என்ஜாய்
Lifting action. Tape, skin, fascia. So what happened? Enhanced blood flow, lymphatic drainage. See that region, dilated blood flow, dilated lymphatic vessels, uncompressed drain the surplus. So this is a very simple technique, but it is you must know where you need to put.
எந்த இடத்துல பெயின்
இது வண்டி டூ வீலர் கண்டிட்டு போனது
டிஃப்ரெண்ட் வேதான் பார்க்கலாம். அம்மா நீ நைட்டில் போட்டு
நான் வந்தோடனே மேடம் தான் பார்த்தேன், நிறைய கேள்வி கேட்டுட்டே இருந்தாங்க அவரை.
டூ வீலர் டிரைவிங் that's
That's a pre-sticking glue, safety for the skin. After 3-4 days, it will give irritation. She can have for 2 days. This will take the inflammation out.
Black color, stick
That's totally different. That's not stretchable.
Sir, one
2 days போடலாம்.
போடலாம்னு சொல்றாரா?
Exactly
3-4 days irritate பண்ணும்.
Okay.
So this gives circulation to the region, and then all this Sir, it comes in all sports shops. Online, Amazon, you can get this one. Different companies. So like,
free exercise, no take a
comforter.
Yes.
See, first thing is when we do any kind of bandaging near the joint, it will restrict that movement. So in this condition, no restriction in the movement. So another thing is like when we do the bandaging, like a crab bandage on the region of the knee or anything, already all this region are in compression stage. We just compress again. But the theory between two is different. That one will prevent the blood clot formation and then give compression and increase the lymphatic drainage. This is to enhance all the decompression region.
காஸ்ட்லியாக இருக்குங்களா?
Sir, what is the rate of that?
ஸோ ரேட் எப்படி?
You can get from 500 to 2000 one day.
1
One day.
surgical shop you can get this.
No, only sports.
அமேசான்லேயே கிடைக்கும்.
Online, Amazon.
Sir, they are using some color tapes and
All
with the
these
striping. Some of them, generally some of them they are telling just like that they are making color, but it's not.
No, color is not different. All color are same only. Color is to give some pleasant influence, brain and pleasant feeling, psychological effect only.
சார் இந்த மல்டி பிளாஸ்டர்லாம் போடுறாங்கல்ல சார் ஸ்வெல்லிங் இடத்துல, அதனுடைய என்ன சார் எஃபெக்ட் பெயின் பண்ணுங்க?
அதுவும் வந்து ஒரு மெயின் ரிலீஃப் தான். பட் ஆனால் அதை போட்டுட்டு if you wear that plaster and play, it will restrict the performance.
ஓகே.
This will not restrict the performance 100%. So
அதில் இன்ஸ்ட்ரக்ஷன் கொடுத்துருவேன், நாளைக்கு 8 மணிக்கு வரணும், எப்படி வரணும், என்ன ட்ரெஸ்ஸில் வரணும், சரியா? அதெல்லாம் கொடுத்துரு.
சாரோட
9 o'clock
பேர்
இங்கேருந்து
என்ன?
நம்ம போகிறோம். பஸ் வந்துடும், 8 மணிக்கு தான் பஸ் வந்துடும்.
8:30 we are coming. 8 o'clock we are finishing that program. 7:30 to 8:30.
7:30 to 9 போட்டிருக்கோம், நம்ம 8:30
9 தான் போகிறோம்.
ஆமாம். இல்லை 9:30 தான் சாப்பிட்றது பிரேக்ஃபாஸ்ட்டில்.
இங்கே தான் 7:30 to 8:30.
Dr. Dharmesh Kubendran.
7:30 to 9
Kubendran. Dr. Dharmesh Kubendran.
ஆனால் பஸ் வந்து 8 மணிக்கு வந்துடும்.
Dharmesh Kubendran. Okay.
this is another advanced sports cupping.
Ice cupping.
Ice cupping. See, this is one of the finest technique for any kind of spine injuries. Muscle cramps post any event Immediately the stiffness and anything like it will go by itself, like easy method. All kind of below body pain, muscle stiffness, chronic spinal stiffness. You know, all these athletes, high performance athletes, after the game they just run and jump into the ice tub. Till here they just soak them to prevent the injuries. All the high performance athletes. So this is targeted to the local area. We just take the cups, put the ice cubes, and then we can move the cups. This was this video was made in yes. Just teaching for the students in Chandigarh.
Sir, shall I ask you one doubt? Earlier when we used to give workout for children, students, we will give workout, no? So during competition time, actually what happened, one day they wanted to go for a swimming pool. Should they go or not?
Yeah, they can go.
But they are going to go for the competition within 2 days.
Yeah, they can go.
Whatever workout they did, that will not come down?
No.
Achha.
Actually, now what they are doing for sports performance is sports rehabilitation. They need to do in different activity, not regularly trying same exercise. It is like a routine.
Okay, fine.
Benefits of clubbing.
இந்த இடம் வந்து சிங்கிள் கோல் பாருங்க இந்த ரைஸ்
This is spine manipulation. All are like targeted manipulation. All are original sound. Actually, all the joints has its own rhythm and then its own movement, like door opening and closing only. And then it is all like only allowed movement. We can manipulate the person, neck or any condition only with the allowed movement only, with the targeted like angle and vector and force. This is known as high velocity, low amplitude method. Grade 5 manipulation. Grade 6 is fracture. What I have done for Sam, no? This technique. When you see like neck movement is flexion, extension, hyperextension, side flexion, rotation, exploratory movement. This rotation, all band. Yeah, all band. Please do not encourage anyone doing this. This will injure the joint regularly. So what we are doing is just make them to hold. Just first make them to do the side flexion and then extension and then thrust. If you see this outside, what we are doing in this video is side flexion, extension, thrust. Okay? Pardon? Yeah. Yes.
Knee rotation band.
Knee rotation. Knee rotation band. Only band. Knee
Alternative.
rotation.
nowadays also doing it, sir.
Yeah, many people are doing so.
Karate class and all that
Alternative
doing.
to touch is permitted.
Knee rotation.
Knee
Karate
rotation
class
band.
doing it.
That is band.
But they are doing everything.